pushing on her, she can lean, she can rotate, she can come forward. She may take her hand onto the table next to her and hold on. So make sure that you're watching for those compensations as well. Not tilting your head off to that same side to try to use upper trap. Okay?
Lifting the shoulder.
A lot of hiking of the shoulder, absolutely, absolutely. A lot going on here in this neck, shoulder region, or tilting the trunk, twisting, lots of compensation. So tell your patient, I want you to stay in this nice tall posture. We're only moving at the shoulder, okay? And what the cues I like to give are always, hold this position, don't let me move you, okay? Don't say, try to push up against my hand or lift against my hand. I try to keep the patient still and say, you hold this position, not so much push against me or try to move me or anything like that. I like to say, you're the Statue of Liberty and I'm the wind. Just hold still. Just let me push. I'm not going to move you. Okay? So for this position right here, you will see some variations with hand placement. And depending on your height, you can vary but keep your own good body mechanics. Come into your test position here for me. If I'm at an okay position, an okay height, I can still flex my knees, get my body weight into it, and be in a good position. If this were someone taller, I may not be able to do that. I may need to come here and lock my hand around the arm and drop my weight this direction. So if I have a really tall person and I'm a short clinician, I may have to change my hand placement to here. But I'm still going to palpate, I'm still going to cue the shoulder and stabilize at the shoulder. Okay? So nice and tall, let me have you raise your arms straight out for me. Okay, hold it right there, don't let me push you down. Hold it, hold it, hold it, and relax. Okay? 5 out of 5. She held maximum pressure, no problem. She was even smiling. So, if I, normal scale here, if I give her pressure, she breaks with moderate pressure. 4. Okay, what's 3? She can get the position, but I give her resistance and she drops. She can't take any resistance. For a 2, I'm going to palpate. What muscles are creating this main muscle? Anterior delt. Okay, I'm going to palpate anterior delt and see, can you raise your arm up for me? If I can get a twitch here, then we're good. You may see a lot of 3 pluses with shoulder. I think oftentimes on shoulder you'll see a lot of the pluses and minuses just because there's some variation. So if someone isn't able to get full range of motion, but they are able to hold it with some pretty good resistance, I see a lot of 3 pluses with shoulder. Okay, so maybe they're down here, they're not all the way up to their test position. We'll see 3 pluses quite oftentimes. This is an easy one in the fact that all 4 grades are in the same position. You don't have to move someone.
You mean 2 plus?
What's that?
Did you mean 2 plus?
No, I mean 3 plus.
Oh.
I see a lot of 3.
3 was like even.
Right, that's what I'm saying, is that even though they're not able to get to their full test position, which would typically give you like your 3s, I'll oftentimes see people get a lot of 3 pluses or 3 minuses. So they can't quite get to the test position, but they can hold resistance, or they can not quite hold resistance, but there's a lot of gray area with the shoulder. So if you feel like you're in between grades, well, I gave a little resistance, but not much, go ahead and grade in between.
So they can hold, they're just not up at 90.
Right, you're not up at 90,
Okay,
exactly. So with a lot of our folks, think about full range of motion at 180 degrees, and I'm an 85-year-old kyphotic lady, and just mechanically, I'm not going to be able to get my arm up to 180 degrees. You will oftentimes see range of motions within functional limits, or your test position, maybe they're not able to get all the way to 90, but they can get most of the way there, and you can test them. We adapt our scale to some degree. So if I am trying to get into my cupboard, realistically, if I'm at 90 degrees and can reach my hand into my cupboard, I can do things functionally, even if I'm not at 180 degrees. So with range of motion, you might see within functional limits, WFL, instead of an actual number for range of motion, or with the manual muscle test, if again, we may not be doing a full brake test, or we may just be resisting through the motion. So oftentimes with geriatrics, you might see, okay, go ahead and lift your arm up for me, and you're just giving them resistance through it. Lift it up, lift it, lift it, lift it, lift it. Okay, and relax. So you're just giving some pressure through the range of motion instead of getting them in position and trying to break them. We don't like to break our elbows. Okay?
What about hand position?
Hand position on this one, just right here is fine. If we want to do supraspinatus, we'll turn the thumb down. We'll talk about that a little bit more next week with some of the variations there. But with our general flexion,
Palm
just palm
facing
down, just in this
Palm down is the
position
chest
is fine.
position.
And then, kind of jumping ahead a little bit, if I'm doing abductions or scaption, as Brian mentioned this morning, it's the same exact test. You're just moving the arm into
Different
an
position.
abducted position or a scaption position. Okay, and then we can talk about hand placement next week.
I'm a little fuzzy still on the 3 out of 5.
Mm-hmm.
So does it have to come to 90 to make a 3 out of 5?
Traditionally, yes. Traditionally, yes. But you may have populations, geriatric person, someone with a frozen shoulder, someone who physiologically cannot get to 90. You can still give them a 3+, or you can still, if they can hold moderate resistance, but they're at 80 degrees instead of 90, I'm not going to dock them a whole number, a whole rating